pressing all the wrong buttons already. Hi, I think that's like the greatest introduction I've ever received, and all will be revealed. So hi everyone, my name's Ticho. I wear quite a few hats, and today I'm going to talk about my main hat, which is working with the XR Health Alliance. But first of all, a little reorganization and a bit of an introduction. So I studied anthropology at university, and it was just as I was graduating that my dad passed away. And I started volunteering at the time in a contemporary arts organization that used to commission all these incredible site-specific installations. And it was there that I sort of understood how things like immersive art experiences, where you felt consumed by them, could almost transform the way that people talked about things like grief. And so I became really fascinated with new ways of telling stories about lived experience. And that's sort of how I discovered immersive technology. So a few years later, I ended up becoming an XR curator at something called the Big Anxiety Festival. And it was there that I sort of discovered all the different ways that immersive technology could be used in healthcare, not just as a storytelling tool, but a way of profoundly improving people's lives. So over that time, I've ended up being involved in quite a few different projects. A couple of them include Deep, which is a breath-controlled virtual reality experience designed in collaboration with artists and scientists from Radboud University Games for Emotional and Mental Health Lab. I'm also the co-founder of an organization called Lemonade, which is a geolocative audio experience that gets people to explore the landscape through music and sound. And then lastly, I'm also the founder of Hatsumi, which means to see something for the first time. And we're creating a tool that enables people to communicate the embodied experience of pain and emotion using 3D drawing, and as a way of being able to improve patient-doctor communication, and also ways of engaging the community and how we can talk about new ways that we experience our bodies. And so, like I said, I discovered all these amazing ways that VR could be used in healthcare, and that there's over 20 different applications, and Walter, I know, did an incredible talk earlier explaining some of the work that's been happening over decades now. But it was at the time of starting my own company, Hatsumi, and I was moving back to the UK and saw that we had this amazing thing called the NHS, where you get free healthcare, which is quite radical, it turns out. But I was like, wow, there's this amazing opportunity to make this available to everyone. And so I started to meet other founders from across the country and say, well, what are you doing? How are you bringing your intervention into the NHS? How does it work? And they were like, oh, it's quite hard, actually. Don't think you're going to have any success. We've just been banging our head against the wall for a very long time. I remember someone once described getting into the NHS, or the NHS, that people think it's a giant whale, but it's actually a school of fish. And you kind of, meet one, and it's quite a challenge to move on. So I approached an organisation called Immersive UK, that were a government organisation, or been sponsored by the government, and something called Audience is the Future, that was supporting immersive technology in the UK. And I was like, guys, we have a problem. There's all this amazing stuff that XR can be applied to in health, but how do we bring it together? And they were like, oh, we've got some funding available, so if you want to do a couple of conferences and events. And so over a few years, we worked with Immersive UK and Barclays Eagle Labs, which are a bank in the UK, and the Institution of Engineering, and we ran conferences and a touring series where we brought together artists and academics and patients with lived experience and companies to talk about all the ways that VR was used in health. And one of the main things that we did a couple of times we found really valuable is that we ran roundtable discussions. So we had private discussions under Chatham House rules and explored, well, what are the problems that we're facing? How do you distribute? How do you work with the NHS? And we found that there was clearly a couple of obvious problems, and we wanted to address that. And then there was this tweet. And I remember Aidan Wolf in a talk at AWE said that, Twitter can be a sort of quantum reality generator, where sometimes you can just throw an idea out in the world and people can pick it up. And this was actually the development of what we later developed. So it was around this time that the BBC were closing their VR labs. And so one of my colleagues was like, oh, there's all these ways that VRs could be used. So how about you give it to the NHS? And me and my colleague Ross O'Brien, who was working in the NHS at the time, were like, we'd like to have that discussion, please. And so we had a conversation with the NHS, and they were like, we need to see evidence. We need to understand how XR is being used in a meaningful way and think about how we can adopt this in a strategic way. So the title of the talk is about the global strategic adoption. I think we want to get to that point, but this is the beginning of that discussion. And so we brought together practitioners from across the UK and beyond, including the University of Nottingham, the National Institute of Healthcare, and a number of organisations to collaborate to co-create this report. And within that, we gave a really solid overview of some of the core applications of immersive technology in healthcare. And we wanted to make sure that we had that diversity of voices, and we interviewed people, we had different people co-author different chapters with us. And I won't go through the whole thing, but I'll give you a couple of highlights. And I think we also really wanted to shine a light on some of the really exciting stuff that is happening in the UK, because I've always been so inspired by what's happening over here, but it felt very fragmented in the UK, so we really wanted to shine a light on what's happening there. So things like pain management, that we know that VR has been used in a lot of incredible ways, and this person, Kay Smith, has been an advocate for VR for some time because she's unable to use a lot of pain management tools, including during surgery, and she's actually been self-medicating with VR, and so she's contributed significantly to our work over the years. And this project as well by Sheila Poppert at Prospect Hospice has been working with Sir David Attenborough to create a VR experience for pain management and anxiety regulation. And I was very passionate to hear about that work, as I'm also an end-of-life doula, and I'm really interested in how VR can be used as a tool for supporting people in end-of-life, both in how it can be used to support anxiety management, pain management, but how it can be used in things like reminiscence therapy as well, and enabling people to explore the places that they perhaps no longer can do. Of course, there's a lot of really fantastic work happening in physiotherapy and rehabilitation, and we've been working closely with someone called Ivan Feeling from the University of Sheffield, who's been doing a lot of really incredible work in prosthetics and working with youths as well in their rehabilitation. Clinical skills and workforce education has been a really key area of focus in the UK. So alongside the National Health Service, then we have Health Education England that have been actually really pioneering a lot of work in XR and training for some time now. And throughout the pandemic, they were using XR in virtual ward rounds and also training students from home and being able to give them tours of histopathology labs or even training surgical skills as well. And then again in patient-focused education, and actually a lot of my colleagues in the UK have been very happy to work with people like Carrie from Embodied Labs to bring that into a lot of training situations as well. And I think one of the most impressive organisations is Torbay and Devon Hospital that have actually been embedding immersive technology in training and working with clinicians to co-create experiences, but they've also been creating social prescribing initiatives as well. And so for those of you that aren't familiar with social prescribing, it's also known as community referral. And this is when healthcare professionals can support patients in the community by prescribing them arts-based experiences or social experiences as a way of kind of creating new skills and looking at people's mental health and physical health more holistically. And in the pandemic, they were prescribing virtual reality headsets to people at home that had agoraphobia or were unable to leave the house. And they found really significant results in people's ability to actually start to leave the house again. And also we had reports of people's alopecia, recovering from their alopecia, and also creating lifelong friendships with the people in their programs as well. Clinical mental health is a really big area as well, and I think a real fantastic example of how VR was used in the NHS was the development of Game Change that was created in collaboration with Oxford VR, the University of Oxford, and also the NHS and beyond, and the Royal College of Art that really thought about that co-design process. How do you work with patients, in this case of lived experience of psychosis, to really look at the design and creation of a tool to enable people to start to reintegrate with society. And then, like I said a bit before as well, I think mental well-being is a really key area and a real opportunity for us to look at of how this can be used, again, in preventative care as well as in intervention as well. And another great project was Lost in Song that was all about singing in virtual reality. And I've been really inspired by work over here as well at using things like VR chat to be able to work with transgender groups as well to talk about mental health and embodying avatars that felt more like how they wish to be represented. Another key part of the report as well was looking at the health economics, and I think it's really important when looking at it from this strategic level that we need to actually explore how can immersive technology and games be cost-saving. And this was a real challenge to put together, and we were really lucky to work with Mindtech, that part of the National Institute of Mental Health, to start to look at some key examples of how we can start to save money. And this is just a very small example of how immersive technology could start to save money. And then if we started to extrapolate that, then in our report, then we expand a bit more on actually what sort of implications this could have long term as well. Lastly, we also worked with the XR Safety Initiative to think about some of these core considerations, anything from cleaning headsets to cybersecurity, and this is something we really need to think critically about if we are going to start embedding this into patient records, how we work with tech companies to make sure that we are creating safe experiences that are deployed in a thoughtful fashion. And so this report culminated in a series of recommendations that we're now working with the government to create. And what I'm really excited about talking to you all about with this is how we can start to think about how this can be done on an international scale as well. So first of all, we had to think about, well, who is actually out there? Like, we knew the people that we knew, and there was a thriving community. But what I find so interesting about this space is that there are the people that are active. You do already have the academics that are out there publishing work, and you have people in industry running their startups. But there are also a lot of artists that are saying, like, I've accidentally created this thing that I think could be useful and therapeutic out there, but who do I go to and how do I collaborate with them? And so we're now starting to commission work through the National Health Service to get an understanding of who is out there and what they're representing and the type of experiences that they're creating. And a really core recommendation as well is, like, how do we create these centers of excellence, and how do we start to create a pipeline from bringing together people from all these different backgrounds to co-create these new ideas, much like the game jam that happened here a couple of days ago. And we're working with universities like Story Futures Academy, which is part of Royal Holloway University, to start that sort of matching process, and then work with hospitals where they can start to do feasibility testing and test them in real-life settings. The NHS have also created something called playbooks or global digital exemplars, where we can say, this is what great work looks like, this is what standards can look like, and this is how we can sort of inspire you to think about how to embed that in your own experience, so you don't get from the point of having a nice idea and then getting to the point where you're starting to actually go to market and then have regulations turn around and say, you can't do that. So really embedding that from the beginning. Again, thinking about testing, scaling up, and working with hospitals to create this and make sure that it's relevant at a local but also national and potentially international level. Thinking about that clinical quality assurance. I know there's FDA guidelines out here. In the UK, we have something called DTAC, or the Digital Technology Assessment Criteria, and thinking about how we can make that accessible to everyone and not so difficult to jump through those hoops that's impossible for small startups, but actually working together to create that. And ultimately creating a procurement framework where hospitals anywhere can dynamically purchase experiences that are known to be, authentic and credible, and have that data behind it to back it up as well. And ultimately, I'm so excited for the future where we can actually meaningfully distribute experiences and have a digital distribution pharmacy, where you can start to look at one centralized place where you can have these approved experiences and use them anywhere. And this could be anything from it being used within a hospital setting alongside a clinician, to other products where perhaps they can be prescribed to people at home. Concept Health Technologies in the UK have done some really fantastic work of prescribing headsets to patients at home as well for pulmonary lung rehabilitation. And so instead of having to wait 3 months to have your physiotherapy, you're now sent your headset within a week and able to do your exercises while sitting on the beach, and doing it daily instead of that time of having to wait for that support. Obviously, it's increasing adherence, but it's making it fun, and that people don't have to wait that long for help, which I think is really exciting. So I'm looking forward to that much more as well. Finally, again, I'm really excited about how it can be used in preventative care. And I really love that a lot of the games that are being shown here are really thinking about how we can start to engage this as something that's fun, that gets us to think about how we experience our brains and bodies. How can we make these experiences available in places like libraries and public settings where we can learn to do deep diaphragmatic breathing or learn different ways of communicating or doing fitness and exercise programs together with people that live far away from us. And again, I really want to emphasize that I think the real success of this, and again, what Games for Change really represents, is how do we create truly collaborative experiences? How do we dissolve these boundaries between industry and academia and the arts and make things that are compelling but also rigorously created? And how do we ultimately make sure that patients are always included in that creative process as well? And then finally, I think our real goal, and the reason that we ended up forming the XR Health Alliance, was actually in response to creating this report. So alongside Fiona Kilkelly, who comes from creative industries and government, and Ross O'Brien, who comes from the NHS, and myself, who's this kind of like weirdo that sort of sits in between and was like, I just want to make stuff. Then we've been working together to think about how we can connect the global XR ecosystem. And it's been such a privilege over the last few years to work with people like Walter and the International VR Healthcare Association and lots of other incredible people in the room to think about how can we start to have these global conversations, how can we start to have conversations with these tech companies that started as games companies but now are like, oh, healthcare is interesting. How do we work with public funders and investors and really start to create this conversation where we can work together to co-create this? Because by no means do I think that the UK are leaders in this space. I think we've looked elsewhere for a long time, but we've had a really exciting opportunity to think about how we can bring these people together. And so we've been really grateful that we've been working with NHS, always rebrand, but there was NHS X that are now NHS England. So X used to represent the technology arm and now are something else, but still National Health Service, working with UKRI, which is UK Research and Innovation, which is government funding to support this work. And they support something called Audiences of the Future, which was predominantly focused on immersive technology in training and entertainment. But we're really excited that we're now starting to receive quite significant strategic support. And we're now looking for more collaborators to join us. And so this is my real call to action. And I'm really excited to be presenting here today so that we can start to have that dialogue. And so I'd really love to speak to anyone in the room from industry, healthcare, games, government that would be interested in working with us to think about how we can co-create this together. And already some of this work, again, is underway, and we're really excited to be working with one hospital in particular that is going to be the UK's first immersive centre of excellence called the Royal Free Hospital in London. And we're working with them to start to think about how can we embed immersive technology across the entire hospital, anything from supporting staff wellbeing to patients in so many different areas, looking at what experiences exist, but what needs to be co-created. And I think that's a really vital part of this landscape mapping as well, of saying, okay, there's a lot of stuff in mental health, but actually mapping that out and saying there's a lot going on over here, and what are we missing? One big area that they're looking at is maternity, and I'm really excited to see more opportunities for women's health to be represented in this space. That's something I'm very passionate about, and so thinking about how that can be used in anything from birthing to educational tools and how we can work with young women to understand their bodies more as well. So thank you so much, everybody. It's been a real pleasure.